to give it a couple of moments just to let everybody join the webinar, and then we'll get started. Okay, amazing. So my name's Kaylee Wainwright. I'm Head of Engagement Advocacy at UK Youth. UK Youth is a leading national charity that exists to ensure that all young people aged 9 to 25 are equipped to thrive and empowered to contribute at every stage of their lives. We support young people to develop life skills, and we work in partnership with a movement of youth organisations around the UK and support them to ensure that young people have the best opportunities and access to quality youth services. We've been running a series of events called Stand With Youth Reimagine, and these have been led and designed by UK Youth Voice, our youth steering group, and we're really interested in looking at what the impact of COVID has had on young people and how we can work together with other leaders and other sectors to reimagine what the future might look like. Today's event is all about health and well-being. I'm delighted to introduce Maria, who's one of our UK Youth Voice representatives, who's going to be chairing the event today. So I'll shortly hand over to her. Just a couple of housekeeping bits. We will be sharing the conversation, encouraging people to get involved on social media. So do use the hashtag #StandWithYouth. We will be taking questions to the panel. So please use the Q&A button, which should be on the bottom of your screen on Zoom. And we will be recording the webinar and hosting it on our website, which you can find later in the week as well. So I'll hand over to Maria, who will kick off the event and introduce the panel. I hope you enjoy, and I'll see you at the end.
Hi everybody, welcome to our discussion today. So as Kaylee said, this is a series of events that UK Youth is holding to reimagine what the future looks like for young people. There's been other topics previously, such as a financial future. Today we're going to be talking about health and well-being, and we've got a brilliant panel here today that we'll be asking questions to. Please do submit your questions. I know you might have already come with some, or some might pop up during the discussion that we have. Pop them in, and then we'll try to get through as many as we can. We're going to be using a hashtag #StandWithYouth. So if you want to tweet any questions, or if you want to kind of contribute discussions over social media, use our hashtag #StandWithYouth. So just to introduce myself, I'm a UK Youth Young Rep. I represent the East of England, and we've got young representatives from all over the UK. I'm also a youth worker, so I work with young people in my local authority as a full-time job. We've also got a young panelist, Xavier, I'll introduce first. Xavier, I'm going to ask you to introduce yourselves a bit more, just so you can, talk about yourselves and add any information you want our audience to know. But Xavier is a young rep as well. We've also got Baroness Diana Barron here today, Mark Lowry, who's a CEO of an organisation called Street Games, and Dr. Lee Hudson. So I'll ask you all. Xavier, would you like to start first and just introduce yourself?
Yeah, so hi, I'm Xavier. I'm 23. I'm from Middlesbrough. I'm the head of the Children in Care Council for Middlesbrough, and I've also helped shape services, and I'm also part of UK Youth Voice.
Brilliant, thank you, Xavier. Mark Lowry from Street Games, could you please introduce yourself?
Good afternoon, everybody. I'm Mark Lowry. I'm the Chief Exec of Street Games. We're a sports charity that works right across the UK. We support local community organisations right in the heart of some of the poorest neighbourhoods across the UK to help get young people more physically active, more involved in sport, and improve their health and well-being.
Brilliant, thank you. And we'll move over to Dr. Lee Hudson.
Hello, hi everyone. My name's Lee Hudson. So I'm a consultant. So I'm actually a consultant physician, a doctor. I work at Great Ormond Street, and the area I work in is young people's health. So I look after general health of young people, particularly mental health. And I'm also a researcher, so I research particularly areas in young people's health and mental health as well.
Thank you. And finally, Baroness Barron.
Hi everybody, I'm Diana Barron. I sit in the House of Lords. I'm the government's Minister for Loneliness, and I work in the Department for Digital Culture, Media and Sport.
Brilliant, thank you very much. Okay, so like we said, today's discussion is going to be all about imagining the future for young people around the context of health and well-being. So we'll kick off. I think we're going to be, we asked everybody to share what their thoughts of health and well-being were via a Mentimeter. And we had a few responses that young people submitted. So I think we should be seeing that pretty soon. Yeah, there we are, brilliant. So our panelists, these are things that young people have said when we've asked them to talk about health and well-being and what their concerns are. So we've got a few: anxiety, loneliness, isolation, sleep, exclusion, motivation. So there's a variety of words there. Can I ask you to just, with those in mind, and just having a look at those, maybe ask your reflections on that, and then also what your biggest concerns are for young people right now, and also in terms of the future, in terms of their health and well-being. So things that are affecting them now, and then what you think that might be leading to in the future. Should we go to Dr. Hudson first, if that's okay?
Yeah. Well, it doesn't surprise me, because this is what we would expect, I think, really, and it's entirely understandable. And if you look at the three biggest words there, they all sadly go together, don't they? So, you know, being lonely, being isolated, and anxiety. And there's lots of reasons to be anxious. We know that often when people are on their own and are lonely and isolated, they're anxious, but we also know that anxiety disorders in young people, so if you take females between 17 to 19, so young women 17 to 19, 25% of ladies in that age group will have a emotional mental health disorder like anxiety. So that's what I'm really worried about. And this really, you can see mental health down there as well as one of the lines, but I think anxiety, loneliness and isolation is a real important thing and a voice we need to listen to, isn't it? And the last comment I would make is that, you know, it's obviously really complicated. We don't know how long lockdown's going to go on for. It seems to change every sort of few days, and the future is unclear. And what is clear is that tackling the effects of loneliness, isolation, particularly anxiety, needs to be a focus for people who are around to help young people.
Yeah, you're right. They do. They speak for themselves, those words do. Would you like to add anything to that, Mark? What are your reflections on these words?
Thanks, Maria. I mean, just to echo really what Lee's saying, I mean, it's very reflective of some of what we're hearing as an organisation from young people, the concerns about their mental well-being, the concerns about being isolated, a lot of young people talking about feeling cut off from their friends. So even though they've got that access over social media, sometimes it's not the same as when you actually are there with them in person, and likewise with family. So it is extremely reflective of what we're hearing as an organisation as well.
Thank you. Shall we go to Baroness Barron?
Thank you. So I agree with everyone else in terms of sadly not being surprised to see these words come up. And I think a lot of people don't know that loneliness is more prevalent, according to most studies, among young people than it is among old people. People often think it's something that affects the elderly, but actually more young people talk about feeling lonely than any other age group. I guess you didn't ask what our hopes were, but I'll give you a hope. I suppose my hope is that because a lot of us now can admit that we're feeling lonely and feeling vulnerable and feeling frightened, all of the things that are on your slide, somehow it gives us permission to talk about it. And we know that just talking about it is helpful in and of itself. So my hope is that changes attitudes and some of the stigma around loneliness. I guess you asked about my fears, or all of our fears. I think I've got sort of two groups of fears. One is a general one, that young people don't lose hope in their futures and don't lose that sense of control over their futures, because at the moment everybody, but I would say particularly young people, have had a huge disruption to our lives. And then I suppose within that there are particular groups that I worry about. So I used to run a domestic abuse charity, so I worry a lot about young people living with domestic abuse at home, but I've also spoken quite a lot to young carers recently, and I'm very struck by the extra pressures on them at this time.
Mm. Yeah, there are a lot of specific groups of young people who are affected differently, and it is important to see them, not to kind of homogenize and see all young people as one group, because everyone has different experiences. Yeah, thank you. Xavier, would you like to add anything to that from your perspective?
With the loneliness and isolation, I think obviously that's going to be a big impact, because there's also social isolation, but there's also isolation of like not being able to go out, or if you are like disabled to actually go out, because then that's preventing something, and then it's also affecting your mental health, and then it also leads on to like anxiety of going out, like when you are allowed back out.
Yeah, we don't think about the whole perspective, do we? About the whole experience and getting used to one, and then the next stage happens. Thanks for that. So we talked about what your concerns are for young people now in the future. What do you think the consequences of these things for the health and well-being of young people are, of the situation now and in the future because of the crisis? Whoever wants to jump in first.
Can I go first?
Yeah, sure.
So I was really struck by what a couple of people have said in terms of what we do about it, in terms of seeing the future and the insecurity about the future. Because the reality is that differentiating between difficulties with mental health and people going through bad times can sometimes be hard, because the way that bad times in our lives make us feel is sometimes the way that mental health makes you feel, if that makes sense. And it's a very hard grey area. But what we do know about the two things that tend to make both of those things better, well, firstly is talking to someone about it. That's definite. So I think it's really important that if you're feeling stressed and anxious, to talk about it, because often, even when you're in your 40s like me, you don't necessarily want to acknowledge to someone that you're not coping, and that's a human response, and it's okay to say you're not coping, because actually we all don't cope at times. So I think that's one thing. But the second thing is hope. Not putting this onto religion at all, but if you look at all major religions and philosophies, and when people have looked at the way that people deal with stuff, it's all about hope, about the future and what's going to happen in the future. So the two things are talking to someone about it and also hope. And whilst we recognise that there's problems and there's loneliness and isolation, I think it's really important to get that voice out today, that there is hope. Actually, I think that the world may be different in lots of ways, but I think there is lots to be hopeful about. Actually, I think whilst there's lots of negative news stories at times about people doing some things that they shouldn't do during this, the reality is, my experience, and I've written on this, is that people are generally, I've seen a whole new side to humanity. And as a doctor, I have to sort of believe in that stuff anyway, but it's really, for me, as someone who looks after people, I've just seen the most amazing array of people giving to charity, people, every single stage, people driving trucks around, and young people, we know, are the people most likely to volunteer in help in their lifetime. Although people get a bad press, statistically speaking, you're much more likely to do something voluntary than I am, because that's what happens. And I think young people have played a really big part in this, actually. And so I think there is hope, because I think we're all going to be the same people as we move forward. And as we make the world different, and as the world evolves, there's lots to be hopeful about some of the really positive things that I've seen.
Brilliant. Thank you, Dr. Hudson. Mark, would you like to provide your perspective on the question was, what do you think the consequences are going to be for young people in terms of health and well-being? And Dr. Hudson raised a good point about there are the positives of this and the outcomes that could lead to that.
Yeah, and I'd have to agree with Dr. Hudson, because a lot of the organisations we work with, the stories that we're hearing at the moment are about young people being involved in what's happening in their communities and really contributing to the community response to the virus and making a real difference. And a lot of these young people were doing that before this situation began, but in some cases they've almost doubled their efforts in responding. And I suppose from my perspective as well, in terms of looking forward with hope, one of the things that we know has a really positive impact on mental health and well-being is exercise. And you'd expect me to say that working for a sport and physical activity charity, but those young people we hear who are engaging in more exercise, it does help to reduce anxiety. It can have a real impact on the way that young people feel. And even though we see that there's a large proportion of young people who, for understandable reasons, aren't comfortable to go out and exercise at the moment, my hope would be that actually we could take advantage of one of the few things we can do at the moment and just be more active, because that can have a real impact on mental health, as I say.
Brilliant, thank you. Baroness Barron.
Well, I would absolutely agree with what Lee and Mark just said. I suppose the thing I would add to it is we are, just as with this webinar, you know, we are discovering different ways of getting help, communicating with one another. And I think that some of the stuff that's happening online in terms of online support and counselling and so forth for those who are struggling is also quite exciting, and hopefully we can build on that and make it much more accessible to those young people who need it.
Yeah, we can, you know, use technology to our advantage, and situations like this mean we have to. There is a lot of good stuff out there, and people are really being innovative now. So it's only starting. People are only starting to, you know, learn what they can do with technology. Brilliant. Xavier, what do you think the consequences of this crisis might be for young people in terms of health and well-being now, and then, you know, however long this goes on for and afterwards?
I think probably like as its consequences is going to be, obviously people are going to be scared to go back out and to actually do normal things. But then I think probably like in the future, it's going to look like, to do for mental health, it's going to be more like obviously like trying to volunteer. So it's trying to change the scenery as well for them.
Brilliant, thanks. The next question is more about what sectors can do to ensure that the future is positive for young people. So I'll go to you, Mark, first. How do you think different sectors can collaborate to support young people now to ensure that the future is positive for young people?
Yeah, I think my reflections on this is that there are already some really good examples of collaboration even before the COVID-19 crisis started. And I think a lot of that has been accelerated through this period. And really what we need to do, I think, is build on that. So just some examples that we're involved in. We're involved in working on a national youth social prescribing project. So that's where GP surgeries have people who then connect with community activity providers, so that if young people do go to their doctor and they're not feeling great, rather than always getting a medical prescription, there might be an opportunity for them to be prescribed some activity that will help with their health and well-being. And that's the kind of partnership and collaboration that I think, in terms of supporting all of young people's needs, we need to bring together. And if I may, just another example for us is about the really important link that's developing in a lot of areas between schools and community organisations. And again, in many areas, those have existed for a long time, but how we really have almost a seamless connection for young people between the education setting they go to and the organisations that support other parts of their life, for me, is really important in terms of seeing the whole of the young person, just not splitting them into the different service areas.
Brilliant. And have you seen good examples of that happening between maybe yourselves or a different organisation and schools?
Yes, certainly. So about 82% of the organisations we work with are doing more collaborative work with schools as a result of the virus. And that can be everything from providing activities for those children of key workers who are having to be in school, but also connecting and being able to go and deliver things to individual young people who might be vulnerable, as part of the community response as well.
Fantastic, that's really good to hear. Baroness Barron, how do you think the sectors can collaborate to ensure a positive future for young people?
Well, I think it's a fascinating time, and I think it's almost like a moment where the kind of contract between government and its people, business and their employers, you know, charities and their communities. It's a chance where it feels like there are big tectonic plates moving, and an opportunity perhaps to do things a bit differently. And we've seen a number of business leaders come out and say, this can't just be about profit forevermore. We have to think about the environment. We have to think about inequality. You know, this crisis has exposed, you know, a load of cracks which are pretty ugly to see. So I think it is a time to kind of reboot. And what is very challenging, genuinely, sitting in government, and I know this is true everywhere else, but there's just so much happening that it's very hard to get the bandwidth to do the sort of broader thinking. But I do think it's a moment where we should all be thinking about what kind of society do we want to live in, and what is within my control to change. You know, the Nelson Mandela line about, was it Nelson Mandela or Gandhi? Somebody could tell me, but the one about is Gandhi, I think, be the change you want to see in the world. You know, it's not a bad place to start.
Yeah, brilliant, thank you. Xavier, do you want to add anything to that?
There's nothing to add.
Okay. And Dr. Hudson, what's your perspective on collaboration?
Well, I would say that people keep saying that there's never been anything like this in a generation, and there hasn't. And in fact, the last big time that was probably like this was probably the last war, wasn't it? That none of us were around for or remember. But you know, that the moments like this do allow people to change things. You know, after the Second World War, they built an NHS. These are moments where people come together. But as I think, as Diana was saying, so I've seen healthcare, I've seen an amazing shift in tectonics. You know, people that systems that couldn't work together have just gone, all right, let's just make it work in a way that they would never have done before. And the things like bureaucracy and actually to some extent funding has just sort of gone, well, whatever, we just need to crack on with this. The danger is that when we go back to normal a bit more, it's just going to go back to where it was. And there will be lots of pulls in that way. But I think one of the most, you know, there are two really important points here. One, is to inspire, to try and get young people to actually have their voice, because actually, you know, you've got a very powerful voice at the moment, and you're going to be the drivers of the next 5 or 10 years of how we don't allow things to go back, or at least if we don't go back. And one of the best things for young people, in my view, for health and for the whole gamut of stuff that's happening, is technology. So I think when we come out of this, people are definitely going to be using technology. I mean, GP practices will be doing this sort of thing much more commonly. And who's better at technology as a generation than you guys? You know, it's easy to concentrate on the negatives and the effects, but actually as we come out of this, you know, as technology so often is driven by young people in terms of as users, you know, you guys are, if you can find a voice, in a really important position to be able to be the drivers and actually really excel in this new world that we're going to come out of. It's going to be hugely more technologically based than it was before, even though it was before.
Yeah, technology is a big part of the future. And yeah, even though I'm still classed as a young person, people younger than me are just far ahead. So it is progressing so fast.
What do you think I feel like?
You can't keep up with it, but yeah, I mean, it definitely can be a driver for a lot of social good, and it already is, as we're seeing. And just want to remind everybody, keep asking questions. We are going to go to Q&As later on, when we get through these. Keep adding them. We've got some brilliant ones already. We've had over 200 people sign up for this event, and you know, the majority of people are here. So do get your points of view and questions across. So the next question is, how do we need to work differently to ensure young people have the best chance of succeeding, and what needs to change? And we've already talked about things that have changed, but is there anything that you think that comes to your mind as, you know, at this point, what could we do that could change and be better for young people? I'm not sure who to go to first this time. Xavier, do you think there's anything that could be changed from your perspective as a young person? What could be done differently that would help in this situation?
Probably like, obviously, like communications better with different like organizations, so we know what's actually going on. But then also I think what could be better is like organizations to do like online better, because sometimes they used to do it just by the books, and it does work online and it will save them obviously transport and money costs. So I think that's what should be changed.
Yeah, like improve the quality of online services.
Yeah.
Yeah, it's a good point. Thank you. Mark, what do you think needs to change, or how do we need to work differently?
I think I'd agree with Xavier, first of all, because one of the things that happened at the start of this was, I think a lot of organisations that work in sport and physical activity realised just how poor their digital and online presence was, and how unfit it was for connecting with young people and actually doing the things that it's needed to do in recent times. So definitely something we can all do better, I think. The other thing for me, which I know is something that UK Youth take a lot of pride in, is more areas need to really hear and involve and engage young people's voices in shaping what they do. I think we talk about youth voice, it's something you hear a lot about, and the lived experience of young people is so important. But I think it's incumbent on all organisations really to think about how do we do that in a really meaningful way, so that young people's views are valued, they're heard, they're acted upon, so that we don't come up with the same solutions that we maybe had previously.
Yeah, thank you. Baroness Barron?
Well, I think somehow we need to come up with a kind of shared vision as a country about what we want the future to look like for young people. So Lee talked about the vision around the NHS after the war. And I think if we all know what we're heading for, then different organisations in their own way can contribute to that. But if there isn't a shared understanding of what a great future for our young people would look like, then we're unlikely to get there. So I think a bit of a national conversation about what would we like, you know, in my case, my children, and hopefully at some point my grandchildren, you know, what do we hope their future would look like, and their friends and your friends and everyone on this call, then I think we can all work towards that. But we haven't had that conversation for a while.
Yeah, as a youth worker, I would agree with that. I mean, I think something that the government and all the different you know, expert bodies can agree on would be a great starting point. Dr. Hudson.
So just a continuation from that, really. I think that through, you know, it's been probably something that's happened for 50 years, but certainly in the last 10 years, there's been this sort of almost an understanding that what different generations want is different. And some of that's because, let's be honest, some generations have got a lot more financially than some generations, and even when you compare them to when they were in a different generation. But there's been a lot of splitting in politics, and I'm not going to mention the B word, but you know, that tore the country in half, and by age very much so, certainly regionally. So we've got a country at the moment that I think age-wise is very split in terms of what its priorities are, and regionally it's really split about what those priorities are, and that's our major challenge. But you could turn that challenge around to say that actually the thing we've all been struggling with for the last 3 months, all regions have had very similar major problems. And generations have had some similar problems. I mean, obviously the health impact for the elderly has been different to young people, but actually what people have been asked to do has been very, very similar. So I think I completely agree with Diana, but I think there's some tears that were there before that somehow we need to come together. And usually, because I'm the union rep for at my work as well, is usually when you want to try and get something done, you find the common common areas. So a common vision is a great idea, but I think we probably need to start, well, what are the common visions? Because there are many different visions and lots of different staked interests, aren't there? But so we could start with the small bits, then that might be a start.
And also in terms of, the topic today is health and well-being. And when you start bringing in, every other aspect of a young person's life, the priorities can be different depending on what topic you're talking about. So it is a really complex thing. But yeah, bringing in young people's experiences where they're living, and also what the generational change and impact is definitely important. We're also bringing up polls for you to take part in, so please do answer them. We're going to look at the responses. There will be 3 throughout this event. And the next question, we already spoke about it a little bit. Dr. Hudson, you were talking about the positives that come out. So that next question is about this. You preempted that one. So are there any positives from this time, and how might we learn from them and take that learning into the future? So Dr. Hudson, you already spoke a bit about it. Did you want to add anything else from what you said?
Yeah, go on. I mean, from a health perspective, so, delivering health to young people, the huge positive is the increased amount of online engagement. People often forget that young people are major users of healthcare, but people don't think that they are. But on average, a young person under 25 goes to their GP once or twice a year. It's the people in the middle that don't tend to go see their GP. So they are actually health users. They're just not necessarily people that people listen to in terms of what health should be about and what's needed. So I think technology is going to change that a bit. I think we're much more both opportunistically, and what I mean by that is how we sort of screen people, how we pick up people who've got mental health problems, and make it much easier to access services by having this, because I've experienced it myself, and I was a bit cynical about it to begin with, but it's very effective doing it this way for most things. And it's really efficient. You can see a lot more people in such shorter space of time. And you come into my office, I can come into your home without us actually invading your privacy or your world. So I think the positive bit will be the way that we now use technology for health. And I think young people are going to be much better at accessing that. And that's a real win for someone who's been banging on for 10 years about how we need to improve access to services for young people. This, for me, is a real positive and something I'm really excited about.
Brilliant, thank you. Mark?
I'm just going to reiterate something I said earlier, actually, because everyone is just so much more aware now of the benefits of being active. I think people knew in some ways, we've heard it before, that we should try and do 5 lots of 30 minutes exercise a week. But actually, the young people we've spoken to, over 60% of them are out walking nearly every day, one way or another, and understanding the benefits that has for your physical and your mental health. I think we've got a real opportunity to build on that and try and get more young people more active more of the time, but equally to recognise that there are some real challenges in that. And for a lot of the young people that we might work with, their access to exercise has been quite limited, maybe by the areas where they live or the opportunities they have to go out with their families. So there's a lot more we can positively do with the time we've spent thinking about the benefits of exercising. The other thing for me is that reflection time that we've all had, apart from people like Dr. Hudson, of course, who've been busy probably large amounts of time working on the front line. But for those organisations who've maybe been more home-based, there's been a chance to really reflect on what are we about? We end up being so busy all of the time. The chance for organisations to think, what am I here to do? And how do I interact with other organisations that maybe do similar things or do things that complement what I do to benefit young people? So I think one of the positives to take forward for me is about that real sense of purpose, clarity about what we do and maybe what we don't do in trying to support young people.
Thank you. Xavier, we'll go to you next. Any positives?
I think the positive is obviously the community coming back together, because usually there is like cracks within the community. But I found out that young people are stepping up to the mark. They're trying to do everything that they can do, but I also think it also put like a connection between the young generation and the older generation, so it's not that much of a conflict. And I think like with young people, they're stepping up and also making a big change, and obviously creating support groups for like people as well. So I think that's a really good thing to bring back the community.
Wow, that sounds amazing. Thank you. And finally, Baroness Baron.
Well, I think for me it's a little bit what Mark was saying about organisations thinking about what their purpose is, without wanting to be too kind of philosophical about this. But there is a phrase about, you know, are you a human being or are you a human doing? I'm speaking personally, I was absolutely, probably still am, but you know, a human doing. And actually, a lot of us have had to be a bit more present. So I think that's important, and I think it's come out in all the, you know, small acts of kindness. So many of us are on local WhatsApp groups or Facebook groups or whatever, just for our street or our block of flats or whatever. And certainly, you know, where I live, if anyone's brave enough to say they need their shopping done, about 20 people volunteer to do their shopping for them. So I think that sort of very simple human connection, you know, we've all lived it and felt it, and I think it's very valuable.
Yeah, I think we can all relate to experiences of more community, and that's definitely a positive that's come out of it. I'm aware we've got quite a few questions to get through. We've just got one more question, and it leads on to this one. It leads on from the last one, sorry. So can I just ask you all to be as brief as you can? So what role do young people have to play in co-creating the solutions of the future, and how can young people do that? Mark, could I go to you first?
Yep. I feel really strongly actually that young people have a leadership role as well as a co-creating role, to be honest, because our experience of working with young people is that they are often the best innovators. They're the ones who can see what is needed for their friends and their peers better sometimes than we can. So I think for me, as well as obviously involving young people in shaping services and support in the way that I described earlier, and really listening to their voice in a way that changes things, it's more about how do organisations like ours and others enable young people to lead, to be the peer leaders, to be the community leaders of the future, as much as be involved in the co-creation process.
Thank you very much. Xavier, what do you think?
Yeah, as following from what Mark just said, like having young people, like obviously leadership roles and co-creation, I think that's going to be the best way forward as well for organisations, because then they can find the cracks and then also obviously fill the gaps to provide for young people.
Thank you. Baroness Baron.
So we've got various groups within government of young people that were that have been very helpful. So I've been working reasonably closely now, and we've got a kind of regular rhythm of meetings with a youth steering group who've been great and very solution focused as well in terms of their ideas. And we've also got what we call youth inspector groups who look at bits of legislation and feedback from a young person's perspective. But I think the challenge for us and them is to make sure that we expand that reach so that those people on the group are representing many other young people as well as their own perspectives.
Thank you. And finally, Dr. Hudson.
Well, I'd say I'll keep it brief. If you've got ideas, you think you know what needs to happen, don't take no for an answer. Be calm, make your argument, and keep going, and keep fighting to make things better and get your ideas through. That's how anyone achieves anything, really.
Great advice. Thank you. So that's all of our questions for you. We're now going to move over to the Q&As, and we've had quite a few. This is my first time doing it, so I don't know if I should click answer live or not. I'll just read them out for now in case I click the wrong button. So a question from Chris Johnson. In view of the evidence for the benefits of outdoor experience on both physical and mental health, what do the panel think of the Department of Education's description of outdoor education as not an active area of policy? Whoever wants to answer that one.
Oh, I guess I better take that one, shouldn't I? I'm trying to find it on the screen.
The last one.
Oh, it's the last one. Bear with me 2 seconds. Well, I guess that might be something about the specific brief, the Department for Education. So some of the responsibility for young people's activities outside school sit with the department that I'm in, Digital Culture, Media and Sport. And in fact, we had a meeting this morning with a number of youth groups, including several who are involved in different forms of outdoor education, talking about preparing guidance to emerge from lockdown. So I think I hear the kind of message behind the question, that if the concern is that it's not picked up anywhere in government, that's not correct. And if there are particular things, feel free to get in touch with me and I'll see if I can do anything to help.
Brilliant, thank you. Okay, trying to listen and I'm not very good at multitasking. So it's a question about tech and versus face-to-face. Question from Katie Davidson. I understand and agree that tech is very important now and for the future, but do you agree that it does not replace face-to-face interaction and the importance and benefits of that, especially youth work and what it represents for young people?
Should I answer that? I mean, I think the vital importance of face-to-face is so clear from what we're hearing young people tell us they're missing most, because you can have some form of connection over screen, as we all are now, but actually that in-person contact is so important. And actually what I've noticed just in my own working period over the last few weeks is how much energy that brings to me in being there in person with people. So I don't think for one moment that we should ever seek to wholly replace in-person contact. We are social animals. That's what we've grown up as. So being with somebody you trust, and a quarter of the young people we've spoken to said that the thing that's really important to them about engaging in their local organisation is that trusted adult, trusted individual that they get contact with on a regular basis. So absolutely, digital can go so far that in-person contact will be so vital.
Yeah, thank you. So this one is more about the creative organisation. So a question from Nat here. I work with cultural / creative organisations and interested in how creativity has been a strength for young people during COVID-19 lockdown. What more can the arts do to support in terms of mental health and well-being? And whoever wants to take that. Has anyone had any experience of arts?
Well, I suppose it comes down to what is art for, which is a whole seminar in itself, isn't it? It's got multiple roles, art, as it's a form of communication, it's a form of enjoyment and escapism. It's not a surprise that as we've gone through history and various things have changed, art's changed at the same time, and there's lots of different ways of doing art. And I'm just saying obvious things, but I suppose art's fundamental to human society, isn't it? Even from when you switch some music on at home to how we communicate. So certainly from a health point of view, we know with children and young people that doing art as a form of therapy is an amazing form of therapy and an amazing way of getting people, particularly when they're having difficulties expressing how they're feeling, to get that out there. So how can the arts, but I guess the thing about the arts is it needs to be embedded everywhere as much as possible, and not just different groups of places. So it needs to be across everywhere. That's my best answer to that one.
Yeah, and as a youth worker, and seeing what organisations are doing in my city, I mean, there's a lot that can be done with arts that's not face to face, and there's been so many good examples of workshops using Zoom for different groups and age ranges. So using what we can at the moment, even just with my young people, I just do an arts and crafts activity with them at the same time over Zoom, and we're not really doing a lot apart from maybe having a little chat, but doing something. And just the fact that you have that companionship there, even if it's through technology, it does impact them a lot. And their carers say it all the time, like when they come off that call, they see them as excited as they haven't seen them, for the last couple of weeks until we had those moments. And it's just over an art activity. So yeah, I think it just bringing people together, doing something that involves arts and something that you're all doing at the same time, has a great impact on well-being. So there was a question about, I think I'm going to just read it off. Okay, so how would you suggest we connect with young people who aren't accessing technology? And I think, we've talked a lot about technology during this, but what about the young people who don't? How have you been accessing young people? How do you suggest we access young people who possibly don't have access to the internet or other forms of tech?
I think obviously since the lockdown guidance has been updated and there's an opportunity to have a conversation or to meet at a safe social distance with one other individual, there's obviously the opportunity in the right circumstances with the right safeguarding in place to have some person-to-person contacts between. And I know there's really good examples. I was talking to a youth worker, a detached youth worker in Norwich the other day, who was able to go out and have a conversation with a young person, who maybe wasn't comfortable connecting over a digital platform, and just be able to have that contact in a safe and appropriate way.
If you get the chance, there's a really great video on Channel 4 News. It's on Twitter and it's on Facebook of them. It's about children, not young people, but I don't know if you've seen it, but it's relatively recent, and they wandered around the streets in East London and interviewing children through their windows. And if you ever want an insight into how children have reacted to COVID and what it's been like inside, it's amazing. I really recommend. It's also very entertaining. They're very funny, but also it's really interesting to see just the diversity of people. Like, some people have really liked it. Some kids have been all right. I've been seeing my family a lot, and it's been better. Others are like, I just need to get out. I'm so fed up. So. But I'll just, even if Channel 4 News can wander around and get people interviewed, so you can't, losing face to face, absolutely, you can't all be technology. You need to have a mixture of both.
Thank you. So the next question is from an anonymous person, but this pandemic has shown that high-pressured, stressful exam system isn't necessary. Are there any changes to the education system that could support young people's mental health in the future? And I don't think a lot of people have considered this question about how the education system has, completely been changed. No exams this year. Does anyone have any thoughts about possible changes there?
This is the bit that's worried me quite a bit. Schools and side of things and colleges. I think, we've had to do what we've had to do in terms of lockdown, but I think, young people and children have made a huge sacrifice in this. If you look at, they've, as a group, in terms of how unwell they get from COVID, it's really, really low, very, very low, just being honest. And the number of children that have died, young people have died of COVID, is very, very tiny. All tragic, by the way, but very, very low numbers. And I think when we come out of this, it's quiet voices that will be the interesting stories about COVID. The quiet voices will be the very elderly and children and young people who've had a lot of decisions made for them, as is the very elderly. And society often has to make decisions on behalf of those two groups. But I think it's going to be interesting, because I think actually when we look back on this, children net unbalanced, and young people have done less well than others. And, you know, when you think about a generation that's really suffered and given up a lot for the whole of society, going back to what we were talking about before, that's what children and young people have had to do through this, because the impact on them from the lockdown is likely to be much higher in terms of their mental health, their economics, or safeguarding that normally are kept an eye on and looked after by schools and the people that they see all the time in colleges has been really absent. And that's something that makes me, I'm not just joking, lose sleep every night about, because as someone who looks after children and young people who are vulnerable, whilst the government did allow vulnerable children to go to school, we don't know who most of the vulnerable children and young people are really. They're out there. So that's the bit that we need to remember, that narrative. And I think the net effect has been worse from the effects of the lockdown than it has on the virus. And they've done that in order for everyone else to be safe.
Thank you. We'll move over to the next question unless anyone wants to add anything more to that. Okay, next question from Ian. I work with young people with disabilities and volunteer with young LGBTQ+ people, and these issues are massive within these communities at the best of times. And we've noticed over the lockdown, it's just getting worse and worse. It's not really a question, but I thought it was valid to bring that up in terms of the impact for young people with, you know, specific needs, or you know, certain groups of young people, how that's being affected. Does anybody have you know, any thoughts on such groups and how we can kind of counter that?
Well, can I chip in? Can you hear me all right? Can you hear me? Yeah. Okay. Sorry, I had the questions up so I couldn't see you. I mean, I think that is, you know, very important for us to kind of hear and listen to, because I think there's some shorter term practical stuff that can happen in terms of trying to make sure in each locality that people, young or old, with disabilities and the LGBTQ+ communities and other communities who are marginalized often in our society, how we make sure that we are particularly sensitive to their needs. And I think the other sort of paradox within all of this is that in some ways, some elements of lockdown have affected all of us the same, as a number of people have reflected on, but actually just really, you know, basic things about, do you live in a flat or do you live in a house with a garden, you know, will have made a massive difference to what your personal experience has been of lockdown, whatever additional challenges you might have in your life. So I think there's something about how we come back together as society. We talked a bit about division, and division can happen in lots of different ways, but I think that will need to be handled in a very, very sensitive way. I think it's a big issue.
Yeah, thank you. So on a more positive note, from Amani Simpson, who was agreeing with you, Dr. Lee, about your comment about hope and the impact, the positive impacts that you've seen around. Just want to give a little bit of a shout out. She's creating a youth campaign called #OurLockdown, and it seems to amplify young people's voices and role models during this pandemic, so we can also focus on the good news. So just a little bit of shout out there for Amani Simpson. So if anyone wants to check that out, do use that hashtag. And also I think we've got time for a final, let's just do one more question then. How can we as young youth workers or practitioners help assure young people we are working with on the certainty of their future? Lots of young people feel a loss of control and a loss of their future plans, disruptions in exams and job offers, etc. How can we as a profession help mitigate this? Xavier, do you have any comments about that? What do you think that young people could really, would really help when working with young people, maybe to do or hear?
It's just like obviously like to set out plans, but not go too far in the future. Like take it as it comes because things are going to be changing, and just make sure that the young person is reassured that they can actually do what they want to do, and it's like nothing's going to really stop them. So it's just like reassurance them like all those steps way through to be honest.
Yeah, just reassuring them and being there for them.
Mm.
Thank you. Brilliant. Thank you very much, everybody. That brings us to the end of our panel discussion. We've had some great questions, couldn't get through all of them, but thank you all for your comments and discussions, and I will hand over to Kaylee.
Yeah. Hi, everyone. Well, that hour went quick, didn't it? There's some great conversations. That was really good listening in. I just wanted to sort of end and hear from you all on kind of final thoughts. I think the thing that really struck me from the word cloud and from the conversations was about loneliness. And we know loneliness can really affect sort of people's physical and mental health. And often we kind of just sometimes see it as sort of a standalone thing, but it entwines into so much of how that affects young people and actually how it will affect them when they become adults and also older people. So I just sort of wanted to kind of give you all, and Mari as well, the opportunity to sort of give any final thoughts on sort of how we can tackle loneliness or what we need to do to sort of, we know that there's so much going on in communities now. Xavier touched on it in terms of that it's been a positive, but at the same time, people are also feeling more lonely than ever. So just to kind of wrap up what, final thoughts, I think, Xavier, let's go to you first as the young person representing on this group.
I think like with like young people, I think like we can also like obviously like I said with community, so it's like getting to know people that you don't really usually speak to. I think that's a kind of a good thing. And also I think like with getting to know other people, it's going to make like the community better.
Yeah, definitely. Mark, any thoughts from you in terms of like what's the impact going to be if we don't do something about this, and how might we be able to tackle it?
I think we had somebody really interesting come and talk at our conference last year about loneliness, and one of the things that she said was that we need to do more to understand it, because I think in terms of finding the right things that will support people who are feeling lonely and the right connections in terms of the individuals or organisations that can help. I think we all instinctively think we know what lonely feels like, possibly, but there's a lot more to it, would be my reflection. And actually for organisations, and I know there's been lots of testing of different approaches around what might work to tackle loneliness, but the young person's experience of it will be potentially very different from a much older adult's experience of it. So for me, in order to find the way to tackle loneliness, it really is understanding what it means and then what are the steps to support young people with it.
Yeah, thank you. And Maria, any thoughts from you?
Yeah, I think I agree with Mark. It's a really complex thing, and there's so much involved in it, like you said as well, Katie, that it's such a big word. And I think firstly with loneliness, it can lead you down a darker path, like it's negative feelings, and it's also got elements of self-esteem in there. How your relationship with yourself, and it affects your relationship with other people and how you might perceive your reality. It definitely is something that it depends on how you view yourself and how your relationship with other people. I think just as like a starting point to your day, just if you feel good about yourself, you'll feel good about how you are interacting with others, and whether you feel a connection, whether you're able to go out and physically see people or not. So do things that make you feel better about yourself on an individual level, and just think about things that you have to be grateful for. I've started a gratitude log, which I do every day, and you know, it really does help. So I think if we take it on ourselves to kind of think about, firstly, it's my responsibility to see if I can feel better about myself, and if you still don't, go to other people and have a good support network.
Great, thank you. And Lee, in terms of, I guess, loneliness affecting physical health, because we often think of it as like something that might affect mental health, which obviously, you know, how do you see that crossing over, and is there kind of things that we can do to kind of address all of that from a health perspective?
So I would never separate the two. So physical and mental health, never separate the two, because if your physical health is bad, your mental health is bad, and vice versa. There are lots of things, as Maria said, there's lots of things you can do for yourself, you know, making sure you sleep properly, having a routine, doing exercise, all those things. But at the end of the day, actually, if you're feeling really bad, and this is the key message from health on this, is we're still here for you. What we've seen nationally is people are not going to services in the way that they were before, and we already knew that the burden of mental health was huge. So, you know, the NHS is still open. People are not going, probably because they don't want to be a burden, or they're worried about getting COVID. But, you know, your GP is still around, the NHS is around, mental health services are still around for you, the charities are still around for you. You know, don't feel like you have to suffer in silence just because it's COVID and you're stuck inside, actually. So there's all those things you can do yourself, but honestly, services are there, so use them.
Great, thank you. And finally, Diana, obviously, is the Minister for Loneliness. Is there anything that, did you want to respond? Is there anything that government's kind of actively doing at the moment in terms of the strategy? I know there's a lot of work going on in this area.
So thank you. I wish I had a loneliness or a connection magic wand in my ministerial toolkit, but they left it out when they gave it to me. So if you find it, you know where to send it. I think that in terms of what we're doing as government, we are trying to reduce the stigma around loneliness. So we've had a campaign called Let's Talk Loneliness, which a lot of people have joined in with, and you know, the main purpose of that is to say it's normal to feel lonely, and I'm sure all of us on this call have felt lonely at different points in our lives. We're putting some money into organisations large and small that are working in this area, both with face-to-face work but also digital responses, and we're trying to start talking to a much wider group of organisations to see their role within it. But I think that, you know, as I think Lee said at the very beginning, and I think I mentioned, it just does help to talk to someone about it. And I think at the moment, the thing that is in our, you know, is a choice that any one of us can make, is to talk to another person and either ask them how they're doing or say that you're not having a great day, because actually the chances are at the moment they will say, you know, well, actually a couple of days ago I had a really rocky day too. So there is a sort of human connection there, which is helpful to both of you. So I would say also thinking about who else might be lonely and just giving them a ring. There's not a lot to lose, and there's potentially quite a lot to gain for both of you. So that would be my last thought.
Thank you so much. And I think especially for young people out there, you know, there are so many youth organisations out there sort of trying to support young people and be that trusted adult. So if any young people who are listening and who are in that situation, you know, do contact us. There's other organisations, Young Minds, The Mix, lots of others as well. So there are people out there who can support you. And as Lee said, there's the GP as well. That brings us to the end of our event. Thank you so much for this great conversation, and thanks to all the speakers again, especially for taking time out of all of your busy days. It's really appreciated. Thank you to everyone for submitting questions. I hope you've all enjoyed the event. Please continue the conversation on our social media channels, and we'll be back next week with another conversation on the future of digital lifestyles. And so we've talked a bit about that today. So do join us again for next week. And yeah, the recording of this will be online soon, so we will get that posted so you can share as well. But thank you so much, and we'll see you all soon. Bye.
Bye.